In this video, I'm going to take you through a couple different things that could contribute to a scapula that wings. Now, a scapula that wings is a scapula that doesn't sit flush on the rib cage. This can happen in standing, where you notice that the edge of the scapula here can kind of pull off of the rib cage, whether it's all down through that inside border here or just the bottom tip of that scapula. It can also be made more apparent under load, like in a plank or in a push-up. Now, the first thing to look at when it comes to addressing the scapula is the shape and mobility of the rib cage. We want to think about the rib cage as the track that the scapula can then move and glide around. We have a convex surface of that rib cage that the concave scapula needs to be able to glide around. If you have compression in the back side of the rib cage here, now we can think about how it's almost like that scapula can't make the turn around the rib cage to keep hugging it. So what we would do is use positional breathing drills and ribcage mobility drills to help promote more expansion in the backside of the ribcage here. This might be paired with some reaching, where we're creating length in that area, and then cueing to get more inhale to expand that area back here, and kind of think about puffing them out from the inside out. On the flip side, we can also think about how compression on the front of the ribcage can pull the scapula forward. So we can think about, by inhaling into that chest wall and getting it to expand, we're then pushing the scapula back onto the rib cage, not by pulling from the back, but by getting that front side to open up and let go to push it back there. Now, we can also think about how, along that same lines, how tight pec muscles here can contribute to the scapula being pulled forward, as that pec brings the scapula forward and also pulls it down. That can be particularly the case when you just get the bottom tip of that scapula winging off of the rib cage. Now, we talked about doing some chest wall expansion. You could keep it simple and do a pec stretch, but we're also thinking about, why is that pec tight? Now, the pec can overwork for a weak serratus that we'll get into in a little bit. So working on some isolated serratus work can help that pec chill out and make sure that that serratus is pulling its weight. We can also think about looking at pec major versus pec minor. So when someone goes to do some pec work, are they actually able to engage their entire pec major muscle here that goes down along their entire sternum, or do they tend to kind of hollow out and use more of that pec minor and contribute to that scapula pulling up and kind of forward and over that rib cage? So definitely checking out that they've got that good engagement for that concentric position. Then we can think about how teaching the pec how to eccentrically lengthen is now not only giving you the mobility from the pec stretch, but also strength through that full range of motion. So I'd much rather work on that eccentric control, so loading a muscle and getting it to lengthen, versus just the passive stretch to help get that full range of motion and control of that shoulder blade to be able to come back and be able to rest on that rib cage. One other thing that can contribute to this too is if someone tends to be in more of a shallow breathing pattern and use their accessory breathing muscles. So this might be someone who inhales and exhales using a lot of their pecs and their neck here with it. So working on breathing mechanics, that comes back to improving that rib cage mobility as well. We can also think too, if they just kind of tend to clench their pecs. So just like we can be more aware of clenching our jaws, people can have the tendency to kind of clench their pecs all the time. And then you're constantly having to work to undo that. So, working on bringing that awareness to stop clenching there can help you have to not always have to do the loosening up kind of side of things. All right, so then now to come back to the serratus is the primary muscle that gets looked at when it comes to scapular winging. But like I said, we need to kind of set it up for success by looking at those other things first. We can think how the serratus, so it's this muscle that rests underneath the scapula here and inserts here, and then inserts onto the rib cage like little fingers to pull the scapula onto the rib cage, and then to help pull it around the rib cage and keep hugging it in. It's particularly important for scapular upward rotation. So a lot of time we're using it with kind of overhead reaching movements. Now, if you have a scapula that already likes to sit forward and pulled around, then it's kind of a little bit of this drawer that's stuck analogy, where we need to work on the letting go, the coming back first, to give it a better position to then push forwards from. If they're already rounded forward here and you're trying to do some reaching movements here to get the serratus, then most likely you kind of run out of space and you're going to be more likely to use more upper traps in pec minor, which defeats this whole purpose of getting those pecs to let go and getting that scapula to rest back on that rib cage. So focusing on some eccentric pec work, focusing on the eccentric portion of your serratus work. So feeling the armpits kind of let go and lengthen as those shoulder blades slide around that rib cage can help then set up a better position for you to do the concentric serratus work of moving forward with protraction and scapular elevation, upward rotation, scapular upward rotation. Elevation would be just going up and down. We want this nice clockwork type movement of rotating around like that. So then now we can think about how with that serratus strengthening too, we can use specific exercises to really eliminate the pec minor and really isolate that serratus to make sure it is pulling its weight rather than the pec minor sneakily getting in there and doing all the work for it instead. Now, lastly, we can come to the backside shoulder blade muscles. So when our scapula is winged forwards like this, we can think about how the muscles between the spine of the scapula and the spine itself are in a lengthened position. So yeah, we can work on trying to pull back and strengthen those, but again, we have to teach that the pecs on the front how to let go, that serratus here how to let go to come back, to help then set those muscles up here for more success to be able to concentrically find them and support that scapula. Now, from a tightness perspective, if we have posterior cuff muscles here, they insert from the humerus here onto the scapula. If they're tight and overactive, what that's going to do is that's going to pull the scapula away from the spine. So if we think about here's my scapula here, and here are my muscles, my posterior cuff muscles here, if they are tight and overactive, they're going to pull like this, and you can see how that would create some of that winging. So what we might need to do instead to start off is doing a little bit of release work here on the posterior cuff muscles to help that scapula relax back onto the rib cage. We might need to do some release work even into the armpit to kind of help it let go. And then when we go to do our scapular retraction work, like our reverse flies and our rows, we're making sure we're driving that movement from the scapula, getting that shoulder blade to slide back and around, and not driving all the movement from just the humerus, which is going to contribute to that posterior cuff area being overactive again. So a couple situations here. We're thinking about how release work can help set the stage, whether that's improving that rib cage shape and positioning for that scapula move on, whether that's thinking about teaching tight areas how to let go so that that shoulder blade can slide back and set up the active muscles for a better place to work from. We can also think about how the eccentric work can then give a better position to reach and come forwards from. So in the end, we're looking for that shoulder blade to be able to work in all directions and stay hugging that onto the rib cage to fully help support it, give nice stability there. And again, thinking about where, scapular winging is just a piece of the puzzle to look at, seeing if someone comes in saying they have neck, shoulder, elbow, even diastasis stuff going on, that we would want to address what's going on in the shoulder blade and improve that scapular winging to then help the kinetic chain of what is going on everywhere else.